what led you to study Ayurveda in the first place?
My first year of medical school, I struggled with sleep issues. And it was, initially very mild, a few nights of not sleeping well. Eventually, it got to a point where I wasn't sleeping at all. And this had gone on for about 3 months. And as a first year medical student, not sleeping and trying to attend classes and that heavy, the intensity of the workload, I really thought I couldn't do it anymore. I was like, I think I'm going to quit. And so my dad's a physician and he's retired now. And he said, you know what? Why don't you go see a therapist? So I went to see a therapist. I'd never seen a therapist before. And the therapist asked me a very pivotal question, which now I think about in so many different ways. She asked me if I was stressed. I was 20 years old in medical school. I think we know the answer to that. And I said no, because
Yeah,
see,
right.
my definition, 30 some years ago of stress was so different than how we view stress now. And so I said no, and I basically kind of went down this conversation of the fact of my family is great. I feel physically well. I'm doing well in school. There's no way I could be stressed. So I actually, didn't believe I was, and she agreed with me. She's like, "Well, you seem fine. I don't think you're stressed." And that was it. So then I ended up going further because I still wasn't sleeping, and my dad had me see a psychiatrist. And this was that, there's things that happen in life uh, that are so powerful and they transition and transform you in such a way to transition your path. This was that moment where my path completely changed. So I went to see a psychiatrist and I was actually excited. I was like, oh, good, I'm going to see the psychiatrist because this is going to give me the answer. This guy's going to tell me why I can't sleep. Sat down with the psychiatrist. I was ready to be there for an hour. Well, did I know how medical system works. It was a 7 to 10 minute visit. He asked me 8 questions. And basically, at the end of these 8 questions, do you feel sad? Do you have low energy? Do you have low concentration? These are all questions, by the way, for major depressive disorder to screen. And I said, yes, 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 yes. He said, you have major depression. Here's Prozac.
Oh,
And I
great.
walked out of the office 10 minutes later, and I was so upset. I said,
Oh,
that's what I
man.
got. So a diagnosis, a prescription, and I said, I don't feel, this is where you trust your gut. My gut was saying, this isn't the answer. You're not depressed. If you could sleep, you'd be fine. All those things you said yes to were because of sleep issues, not because of depression. So I
Yeah.
knew enough to know, and I was early in my training, first year in my medical school training to say, well, this doesn't seem right. So that is how I got into Ayurveda because I went to the bookstores. I was desperate to do anything. And honestly, within a month, never took the Prozac, was sleeping again. Here I am, 54 years old, sleeping beautifully. I'm on no medications.
Just give
I'm,
us your top three tips
yeah.
from Ayurveda for a patient with migraines
Uh,
not sleeping.
okay, so number one thing, and this is the hardest thing for me to do. The hardest thing for me to do. And even my friends now, or colleagues, or patients and coaching clients, whenever I mention this to them, they look at me and say, come on, set a routine that is so solid that 90% of the week, if not 100%, you stay to it, meaning that you get to bed at the same time, ideally in Ayurvedic medicine, 10 p.m. And I can go through the 10 p.m. bedtime. And ideally, you wake up as soon as the sun rises with the eyes open and get out of bed. That circadian just reconnection to the nighttime allows you to make cortisol appropriately in the morning and then brings your rhythm back into harmony during the day. And that was part one. Part two is what is your mind doing as you enter the bed?
Hmm.
So crucial. Before you start thinking about melatonin and start doing all the fancy things that, supplements and trying all these, different devices to get you sleeping, what is your mind saying to you about sleep? I practiced it at bedtime of imagining just lying in bed and being relaxed and being so grateful and thankful that I get to rest. And even if I'm not sleeping, I'm enjoying the bed. And I honestly would just talk to myself like that and just say, I love being in the bed. And there were nights where I was just up the entire night, but I was in such a pleasant mind space, it helped. And then the third thing, which is Ayurvedically very, very important, is to make sure you're doing something to quiet that excitable nervous system down each day. And I, at that
Hmm.
time, was doing kickboxing.
Mm.
Not a good idea
Not going to
because the
settle you
brain,
down.
it only
Yeah.
thinks you're in danger mode. You're fighting. You're literally
Yeah.
turning on the reptilian brain, right? So
Yeah.
even though I did not want to do this, I resisted, started yoga. And I started doing very restorative yoga. So I
Mm.
only practiced about 20 minutes a day, but it was that like, and then I added a few more things that are a little bit more exotic. But the top three are just the get to bed, just even if you don't feel sleepy, lying down at the same time, it triggers the hypothalamic, kind of system to kind of say this is time for eyes closed and rest, not to be active and on. And then the fact that I kind of quieted my mind with my verbal internal, kind of languaging. And then that third piece is really in the morning saying, I'm not going to get up and jump. I'm going to start with something really restorative and learn to breathe. And I had never been one that had done yoga. And I think at any age, any time, we can all bring these practices in, you know.
Yeah, I think it's totally underrated. I
Yeah.
had a similar journey with yoga when my first child was born. I mean, I did not know what anxiety was until this little child would
Oh,
cry, and I would be like, "Okay, you're fed, you're dry. I just held you. Why are you crying?" I mean, oh my goodness, the anxiety of
unbelievable.
being a new first
New
time,
mom.
very worried mom.
Yeah.
And that was actually the impetus in my life that created so much worry and stress and just started ramping my nervous system up and up and up. And yoga was the only kind of exercise I could do where after I did it, I felt better. I didn't feel depleted and drained.
Yeah.
I actually felt calm and energized.
It clears the amat, clears the emotional and the physical, because not only are you feeling your neck open up and you're feeling your body clear physically, your neck is holding maybe anxiety and fear from something that maybe has nothing to do with what you've experienced. Maybe it's how your mom experienced things and you picked it up. Our grandparents, right? And we carry it in our neck and shoulders or in our hips, most common places, right? So the beauty is that, right? You get that cleansing happening and you feel like sometimes you're not doing anything because you're holding a pose and saying, wow, this seems so simple, yet it's so powerful and
Yeah.
so transformative, right? So yeah,
Yeah.
that was big for me. And I think because I've been practicing for so long, I can point that out and see that difference,
Yeah.
and it's
Yeah.
fascinating. Yeah.
Metaphors for life, right? Um,
Yeah.
so I'm curious, how do you define stress now?
Yeah. My favorite is anyone heard of Hans Selye, Dr. Hans Selye, Hungarian
Uh,
endocrinologist. He's passed now. He was considered to be the father of stress. This guy figured out concept of stress is has a biological effect on the body. If I just say I'm stressed, it's not just something that is going to be experienced without having an impact on my physical being. He was able to document the stages of adrenal imbalance based on how
oh,
stressed, and he's the four stages of stress. And so what he discovered was that stress has this impact on the body. And I love his kind of version of the definition, which I kind of modify a little bit, but I'll give him credit. Dr. Hans Selye, he basically said stress is when the demands placed on the system are more than the system can handle. When the
mm,
demands placed on the system are more than the system can handle. Think about basic physics. You have a bridge. You have cars going over the bridge. Few cars, yeah, sure, no problem. But let's say you have a pileup. Let's say you have some weakness in the bridge. Let's say there's more, intensity of weight, and that bridge just can't sustain it. Stress on that. It's physics. The basic law of physics is that that bridge can break. We can break if we
mhm,
have too much placed on us. And what's
mhm.
interesting is that we're typically placing it on ourselves.
Oh,
It's not
that's so
anyone
insightful.
putting,
That's
it's
so
us,
insightful. We feel like it's coming from outside us, but it's actually us. Yeah,
which
yeah.
is hard to hear, but it's true. And
I'm curious what you would say to somebody who says there are situations that are causing stress in my life that I can't control.
sure.
I just have to deal with it. There's nothing I can do about it.
Yeah, and I think that's where I go to the serenity prayer, like knowing the wisdom to know what you can control and what you can't. Because at the end of the day, yes. I mean, look at the world right now. There's so many things that could, if we allow them to, give us the feeling of stress. Yet
Mhm.
at some level, just to survive life, and God bless what happened in Texas. And, it's not that we don't have compassion and have love for what people are going through and their struggles. We unfortunately can only take so much on because that demand placed upon us can be too much for us to handle. It's just saying that this is what I can take. And you're the one has to say, I'm sorry. And she was kind enough to ask me, but most of the time it's right.
Especially with women. I think that we just
Yeah,
so intuitively give, we take care of everybody else, and too often we put ourselves last. And I think it's just culture. I think it's partly biology. It's partly just overwhelming love for our
Yeah.
family, and really just wanting to do our best. But it is so hard, I think, as a
Yeah.
woman in modern America to say no. To say no to your family, to say no to your job, to say no to your pet,
No to
whatever
your pet.
it is,
But what you're doing is you're saying what? Yes to yourself. And
Ooh,
so I
say it again,
always
say that again. I love that. I love that.
you say no to others to allow yourself to say yes to yourself.